In vitro fertilization. The in vitro fertilization process consists of several key stages. Ovarian stimulation. Here, patients receive hormone medications via subcutaneous injections to encourage the ovaries to produce multiple follicles. These follicles contain the eggs needed for fertilization. This phase usually begins within the first few days of a menstrual cycle and continues for about 8 to 11 days. Throughout this period, the growth of the follicles is carefully monitored through ultrasound exams. Once the follicles reach the desired size, a trigger shot induces ovulation, and egg retrieval is scheduled approximately 36 hours later. Egg retrieval, fertilization, and embryo culture. On the day of retrieval, the patient should come to the clinic fasting and accompanied. The retrieval is done under anesthesia in the operating room using a needle guided by vaginal ultrasound to collect the eggs from the follicles, a procedure that typically lasts between 10 and 15 minutes. Afterward, the patient can usually go home within 2 to 3 hours, advised to rest for the day. Laboratory investigations. The collected eggs are then examined in the lab. Each egg is injected with a single sperm to achieve fertilization. The fertilized eggs are then placed in an incubator, creating the perfect environment for their development. Within 18 to 21 hours, we check for successful fertilization and continue to culture the embryos until they develop into blastocysts. This is an advanced stage of development that occurs about 5 days post-fertilization. Embryo transfer. On the transfer day, the patient will decide how many embryos to transfer to the uterus. This procedure is straightforward and does not require anesthesia. A catheter is used to carefully place the embryos in the uterus under ultrasound guidance, ensuring optimal placement. The patient can typically return home immediately afterward and resume normal activities, avoiding strenuous exercise or any high-risk activities. A pregnancy test is then scheduled 12 days after the transfer to determine if the implantation was successful and pregnancy has occurred. Ready to take the next step in your fertility journey? Schedule an appointment with our experts today and explore your options with Nicosia Fertility. Visit nicosiafertility.com IVF to learn more.